name's Courtney. I'll be your nurse today. Are you
Hi.
AJ?
I am. Nice to meet you.
I'm just going to ask you a couple questions and do like a quick assessment.
Okay.
So, do you have any past history of skin disease like eczema, or any allergies that like cause skin problems or hives? Okay, that's great. Changes in moles. Do you have any mole changes like increase in pigmentation or size? Okay.
No.
Do you have any excessive dryness or excessive moisture that you've noticed? Okay. Any itching on your body?
No.
Okay. Excessive bruising or sun exposure? Do you wear sunscreen when you go out in the sun?
Always.
Okay. Do you take any medications that interfere with how your skin? Okay.
No meds.
Any recent hair loss?
No.
Any occupational environmental hazards that I need to be aware of? Okay. And then how do you care for your skin, hair, and nails?
I wash it.
Okay, that's
Shampoo.
great. Alright, it looks like if all of your skin is evenly pigmented, even color, you're warm all over. That's great. Do you have any freckles and moles? You have some freckles. Okay, that's normal. It looks like everything's normal throughout, and you look pretty moisturized. You don't look dry or anything like that. It looks like everything is smooth, that you don't have any lesions that I need to be aware of or that you've noticed on your body. Okay. And no edema present. That's great. That's swelling. And then I'm just going to pinch and check for your skin turgor. Great. It goes back to normal. That's awesome. Alright. And then it looks like you stay in good hygiene. That's great.
Okay.
You wash daily. Alright. I didn't notice any bruising, so that's great. Now I'm just going to like look through your hair.
Okay.
Put it in like little sections. I don't notice any dandruff or lesions, so that's great. And there's no graying, so that means that the melanin in your hair is normal, especially for your age. That is great. Have you noticed any excess body hair?
I have not.
Or no hair loss? Everything looks even on your scalp, so that's great.
Good.
Alright, now I'm going to look at your nails. Everything looks great. I don't notice any clubbing. That's great. And your capillary refill is less than 2 seconds, so that's brisk. And everything is consistent and smooth. The shape in your contour is great. They're clean. So, yeah, no clubbing.
Okay.
So about once a month you need to look in a mirror and evaluate your skin, or even, have somebody like a spouse do that as well.
Okay.
So they can just like look for abnormal or like changes in your skin, maybe even like bring out a measure or measure like different moles and check the size and the texture of those. So you can also take a small mirror and like look at the bottom of your feet and notice in between your fingers and things like that, because that's where there's a lot of friction and our moles might increase into something that we don't want.
Okay.
So, and then you can use a blow dryer to look at your scalp, different spots if there's like moles or lesions up there as well. Alright, so now we're going to move on to your head, face, and neck.
Okay.
Have you had any headaches or noticed any more frequent headaches? Okay. Head injuries in the past?
No.
Any dizziness? Limitations in motion of your neck or head or anything like that? Okay, I can see you're turning side to side. That's good. Any lumps or swelling that you've noticed?
No.
Okay. History of head or neck surgery that I need to be aware of?
Not. No.
Okay. Alright, so right now I'm just going to palpate your head and check for any
It feels good.
any abnormal bumps or lesions or anything like that. Everything feels very symmetrical. Does anything hurt while I'm pressing? Okay, that's great. No tenderness? Alright, I'm just going to palpate your temporal artery. Okay, I can feel that. That's great. Alright, can you smile and to open and close your eyes? Okay, everything's symmetrical when you move, so that's great. And there's no like involuntary tics, so that's even better.
Yeah, that's good.
It looks like your head is in line and your ears and everything are symmetrical to each side of your face, and your trachea is in the midline.
Okay.
Can you take your chin to your chest, please? And then your ears to your shoulders to each side. That's great. And then backwards. Perfect. And there's no tenderness or hurting when you did that? Okay.
Mm-hmm.
All right, now I'm just going to check your lymph nodes, okay?
Okay.
Can you open your jaw right here? Okay. All right, perfect. Is there any pain with that?
Mm-mm.
Okay. I don't feel any swelling in your lymph nodes, so that's great. Did anything hurt when I touched it?
Mm-mm.
Alright, now I'm going to check your thyroid gland. So what I'm going to need you to do is just take a drink of water while I palpate your trachea and...
Now?
Yes. Perfect. Don't feel any abnormalities, and I can't feel your thyroid gland.
Good.
And again, your trachea is in the midline. So now what we're going to do, we're going to do an eye test. So if you notice any eye changes, like when you're driving at night or when you're reading or anything like that, okay.
Mm-mm.
Any blurry vision?
Mm-mm.
Okay.
No.
Blind spots that you're aware of?
No.
Okay. Double vision?
No.
Redness or swelling, any discharge? Okay. Does your family have a history of glaucoma?
No.
Okay.
No.
And then do you wear any glasses or contacts?
Mm-mm.
Okay.
No, I don't.
Alright, so what I'm going to do, I'm going to have you stand up. I'm going to have you cover one of your eyes, and then the eye chart is 20 feet away, and I'm going to have you read that from top to bottom. E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C. Perfect. Now the other eye. E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C. Perfect. You have 20/20 vision. Great. Congrats. Alright, so we don't have to do the near vision test because you're not over 40 years old. So
Okay.
when that time comes, we'll do that.
Okay.
Now we're going to do what's called a confrontation test. So I'm going to have you cover one of your eyes, and I'm going to cover the other one of my eye.
Mm-hmm.
And then I'm going to have you say when you can see my finger, okay?
Okay. 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 Yeah. Now.
Okay, now we'll switch. Good.
Now. Now. Now.
Okay, that's great. So what that test indicates is that you can see the different degrees of motion, so pretty much your peripheral vision.
Okay.
So that's great. You can see all of your peripherals.
Okay.
Alright, now I'm going to have you stare straight ahead, and I'm just going to check your pupil size and everything, so just stare straight at my nose. Perfect. Your eyes are reactive and equal. That's great. And then I see a bright white light whenever I'm looking at your eyes, and they're in the same spot, so that's normal. And now I'm going to check for like a gaze drift is what they call it. So I'm going to cover one eye, and I just want you to follow my finger. That's great. That's great. And then when I take the paper away, everything is the same. So that's great. So you passed the gaze test. Alright, now we're going to do, now I'm going to have you follow my finger. Yep, perfect. Perfect. All right, that's right. And that's called the 6 cardinal positions of gaze.
Great.
So, all right, now I'm going to have you lift your eyebrows.
Oh, I'm sorry.
It's okay. That's fun.
Just turn that right off. Okay.
All right, everything is normal with your facial expression, and your eyebrows move symmetrically, so that's great. I was going to check your eyelids and eyelashes, and I don't see any redness or swelling, so that's perfectly normal. And then there's no protrusion of your eyelids or your eyeballs, so that's great. Now I'm going to look at your sclera, and it should be like white. Look upwards. Perfect. And no redness. Look downwards. Okay, that's great. Your lacrimal apparatus, that's what I just checked when I asked you to look down, so that's great. Now I'm going to look at your cornea and your lenses again closely. Alright, so just look at me. That's great. So before, your pupils are about 3 millimeters, and then they go down to about 1 millimeter when I shine the light in them. So that's great. And then with the ophthalmoscope that we just used in the dark room, we checked the color and the shape and the margins of your cup-disc ratio. So everything seemed normal with that. Everything was round and oval, distinct and sharp, and normal color.
Good.
And then your veins, there was a 2-to-3 ratio with your artery and veins, and a decrease in the caliber of your periphery. And everything was normal with the ophthalmoscope. And your macula was normal as well.
Great.
All right, now we're going to do an ear test.
Okay.
So I'm just going to look inside of your ear with my light and make sure everything is normal. How do you clean your ears?
I don't really clean them.
Okay. That's fine. Everything looks normal. I don't see any discharge.
I use Q-tips.
Okay. Didn't know.
I think that's bad.
All right. So the size and the shape of everything is normal with your ears. They're very symmetrical. And I didn't see any lumps or lesions on your ears, so that's great. And is there any tenderness when I was touching your ears?
No.
No, everything was normal when I was tugging on them.
Mm-hmm.
Okay, that's great. I didn't see any redness or swelling or discharge, and no earwax or foreign bodies, so that's even better.
Good.
I just checked your external canal. There's no discharge or swelling again. And then your tympanic membrane was shiny, translucent, with a pearly gray color. And it was flat. And there were no perforations. That's why you haven't had any problems with your hearing. So.
Oh, good.
And since you haven't had any problems with your hearing, we don't have to do the whispered voice test. So, and then, or the Weber or the Ryan test.
Okay.
Because they haven't, they've been shown to give inaccurate results.
Oh, we don't want that.
No. So now we are going to do an examination of your nose, mouth, and throat.
Okay.
Have you had any discharge or colds lately? Okay, it is almost flu season, so maybe you think about getting the flu shot.
Okay.
Any sinus pain?
Mm-mm.
Any trauma? Do you have nosebleeds?
No.
No fights? No car accidents?
No.
Any allergies?
Mm-mm.
Any altered smell that you've been aware of?
No. Mm-mm.
Alright, I'm just going to check the symmetry of your nose. Everything looks normal. No deviated septum. No coke.
Oh, good.
Yeah. Alright, so I'm gonna just touch your nose. Nothing feels out of whack. Okay. No pain. That's great. Yep, and your turbinates, they have normal color. There's no swelling. And then I'm just going to check this one more time for your sinuses. Sometimes they can have a different color on them, but your sinuses look normal.
Okay.
Alright, now I'm going to look inside your mouth. Your lips look like they're of normal moisture and color, so that's great. And then I just want to take a look at your teeth. That's great. You go to the dentist regularly? Okay. Yes, you have white, straight, evenly spaced, clean, and no decay, so I believe you. Gums, have you noticed any bleeding from those as well? No swelling?
No.
Okay. I'm just going to have you lift your tongue up. Normal. And can you move it from side to side? Okay, that's great. And stick it out and say ah. Okay, everything looks normal there. You have pink buccal mucosa, and it's smooth and moist, so you're not dehydrated. Your uvula is normal, and your tonsils are 1+, which means they're visible, but they're not swollen.
Good.
So that's why you haven't had any problems with that. Your tongue is normal. It's a normal color. It's pink. And then I'm going to pinch your cheek and open it for you. Okay. And there's no pain or swelling with that as well. Okay. And that's called the Stinson's duct.
Okay.
So everything seems really normal with your assessment, so congratulations. Do you have any questions for me? Okay, thank you so much.
Thank you.